I just wanted to say a few words. It gives Haroon and I great pleasure to be chairing this first session of the conference. And a deep sense of honor to be in the company of such incredible advocates for child health, and to learn a little bit of the history, and to, in some ways, be following the path that you've set out for us. So a great thank you to the leaders that have gone before us, and may we follow in that path, that journey.
Okay, ladies and gentlemen, I think it's time now. We've done the soft bit. Now we get to the half bit. I know that's a terrible thing to say, because I often said you do the fluffy things when you do these bits, but that's not true. But this is every conference surprises us, and we give the initiative to the conveners and the team to design the program how they wish. And I think this was a wonderful new approach, recognizing and paying tribute to our leaders from the past. So from my side also, Tony and the team, thank you for the session we've just had. Okay, so what about this hard stuff? Well, our theme is very clear. Our theme is survive, thrive, and transform. And this morning's sessions really gets us going on this path, looking at the global aspects of the same theme, and then looking at what's happened since our last conference in South Africa. And you'll see the presentations cover those topics. So let's get on then straight away, Laurie, and we'll get on to our first speaker. Our first speaker is Dr. Sanjana Bhardwaj. I think familiar to many of you, because Sanjana has become a regular at these conferences if you have attended. And her official title is she's Chief of Health, Nutrition and HIV/AIDS at the UNICEF South African office. And in that role, Sanjana does lead teams across health, HIV/AIDS, and sanitation and hygiene programs. And she's worked in a number of settings, so she's got a lot of experience, HIV programs in places like Papua New Guinea, she's worked in India, and she's also worked in the Caribbean. And currently in South Africa, Sanjana has really been taking on this 3-feet approach, which I think we'll hear about much more during the conference as well, which is really decentralizing and strengthening health systems at a basic level. And that's what Sanjana has been spending a lot of her time. She doesn't only sit in Pretoria attending all those meetings at UNICEF. And from my perspective, Sanjana has been a very strong supporter of this initiative. As people know, this is our 7th conference, and UNICEF has been there for us from the start. And the only reason that this conference has survived, thrived, and perhaps will transform is because of the incredible support we've had from UNICEF. And as I said, many thanks to Sanjana for being that supporter. So the first presentation is Sanjana's about, and it's titled Getting to Action, Operationalize, a big word, operationalizing the global strategy for women's, children, and adolescent health, survive, thrive, and transform. Thank you very much, Sanjana.
Thank you very, very much, Haroon and Laurie, for those words and the introduction. Very, very good morning to everyone. It's truly a pleasure to be here, and a privilege and an honor, actually. I must say the morning session, as for many of us sitting here, it was overwhelming, but also very inspirational to actually hear the stories and sort of get a glimpse into the leaders of child health in the country. And I'm hoping that this particular presentation will actually build on that, because what so many people saw as a vision, and so many people worked for that vision, and all of us in the room believe in this and do believe in making sure that nobody is left behind. No child is left behind, no woman, no mother, no one anywhere. The global strategy that has now come about for the next 15 years actually tries to crystallize it, get us there. And I would like to share with you a little bit of what the global strategy says, and then to move it to what the UNICEF strategy says globally as well as for South Africa. So just to start off, I think I'm just gonna. So we know this, we've been speaking of it, and I think these are quite, I would say, weighted words. Each one carries quite a bit of meaning and quite a bit behind it. But you're going to hear more and more as we go along in the 3-day meeting, but also you're going to hear more of it for the next 15 years for sure, because the entire basis of the global strategy is around survive, thrive, and transform. Like I said, I'll be talking a bit about the global strategy, the operationalization and what's happening, and then moving it to the UNICEF strategy. Hopefully people have seen this. This is the SDGs, the Sustainable Development Goals. There's 17 goals. As you know, we had the Millennium Development Goals sometime back, the MDGs, that ended in 2015. And now the world has signed up for the SDGs. Very ambitious, but achievable. We can try for it, and we can go for it. And if you look at number 3, that's the one that is concerning us. It's the one for good health and well-being. The strategy actually has 17 goals and 169 indicators. And I know we kind of think 169, oh my goodness, but believe me, there were more than 1,000 when they started off, because each box here had several hundreds of indicators. And there was a lot of work done with the global teams and technical people to actually bring it down to 169. And then I'm going to move on and really share with you something about that whole SDG 3, the good health and child health in particular, which is this particular meeting is focusing on. And we know, and we've seen it, and evidence has shown us, that between the last 2 decades or so, 50% of reduction in child mortality actually was due to interventions beyond the health sector. And I think that's an important thing for us to understand, because children do not live in isolation. We live in communities and families where children are impacted by the environment around them. And I think that's an important point that the SDG makes, as well as what the global strategy says around improving child health. It's also a determinant of multiple SDG outcomes, meaning if the other boxes that I showed you actually achieve what they're setting out to achieve, you will also, in turn, trigger the achievement for good health and well-being. We know this now, and we have models and estimates that actually show and make the point that is being made here. This is the global strategy, and I'm hoping people have copies of it. It is available online. You can download it, and I'll share with you the link. You can actually see it. You can read it. But it's also got something that's interesting this time. It's not just a strategy. There's a whole operational framework behind how you actually implement the strategy and make it work for you at the country level and at your local level. It was done under the whole umbrella of the Every Woman, Every Child initiative of the UN Secretary General, along with all countries that are signatories to this particular SDG, as well as to the global strategy. South Africa is very much a part of that entire commitment from all the countries. We are one country that has signed up for it. I thought it would be appropriate, obviously I don't have time to share the entire strategy with you, but to take a minute and just put up the vision. This is by 2030, and it's talking about a world in which every woman, every child, and every adolescent, in every setting, realizes their rights to physical, mental health, and well-being, has social and economic opportunities, and is able to participate fully in shaping prosperous and sustainable societies. You can see it's quite a vision. And for the first time, in many ways, the Women and Children strategy has particularly mentioned and acknowledged adolescents. And you'll see as we go along that they are a very important feature of this entire global strategy as well. So this is in a nutshell in one slide that shows you what does it really cover, what does Survive, Thrive, and Transform cover. And if you look at the top one, that's the Survive piece. That's obviously about ending preventable deaths. And you've got maternal mortality, newborn, under 5, ending your epidemics of HIV, TB, malaria, and neglected tropical diseases, and you've got premature mortality, mental health, and well-being. So it's kind of packaged there, and if you go into the document, you'll see details about each one that's listed out there. I'm not going to, in the interest of time, I'm not really going to go into details of it, but it gives you a snapshot view of what we all are talking about when we say Survive, Thrive, and Transform. The Thrive piece is around promoting health and well-being, and here is where you see the nutrition piece, you see access to sexual reproductive health services, quality early childhood development, ECD, you're talking about pollution, and you're talking about universal health coverage. That's the Thrive piece. And then you've got Transform, which is expanding your enabling environments, and here you've got poverty, you've got quality education, violence, drinking water, sanitation, hygiene, research, innovation, having an identity, birth registration, and partnerships. So just for a minute, if you look at this entire list, and you just sort of envision and link it with the vision, and if we can all do this together, I think the world will be a completely different place in 2030, if we can possibly get to these targets and ambitious goals. I also would like to just share with you that a lot of work, as you can imagine, a lot of consultations, the whole world was involved in getting this together. There has been tremendous amount of modeling done to kind of make sure that what we're saying is the right thing to do. And each of the bullets that I pointed out in the earlier slide have actually been modeled to show what are the returns on investments. As we know, we kind of all believe in this and we know it has to happen, but you do need actual data and evidence to show that this is going to work. And what you see up there is obviously it's going to be majorly useful, majorly giving you a high return on investment in terms of money, but also in terms of what you're going to get in educational outcomes, in your workforce participation, and most of all, the last bullet, which is an important one, that there'll be a grand convergence on health. You know, you're trying to kind of bring different things together and not just be a health-focused sort of approach to getting the results. And then to just quickly share with you the couple of slides on the operational framework. I thought that would be relevant at least for this meeting, because often enough we present the strategy, but we have no idea on how to actually implement it. This time around, this global strategy comes with an operational framework. It actually gives you ingredients for action. And as I was going through them, I was thinking, you know, it's like a dish. You're cooking something, you've got a dish, you know how that dish will look, but then you need a recipe, you need ingredients, you need a process tool of how to actually cook that dish. And the strategy documents actually do exactly that. They're giving you the ingredients, they're giving you the tools, they're helping you how to know that you've got the right dish and how you're getting to where you want to get to. And I think that's hugely useful, and especially for the audience here, it would be great to actually visit this link that's up there and to actually be able to go and see this for yourself and download those pieces that are more relevant to your work and the work that each one of you is doing in the ground. These are the ingredients. Again, not to go into details, but just gives you a snapshot of what the ingredients are talking about. And as you can see, there's a huge amount of focus on leadership. We all know, and we've heard it in the morning and we've been inspired by it, that it does take leadership to get to where we want to get to. Without that, we're not going to make it. And the operational strategy for women, children, and adolescents speaks quite a bit about that. And then talks other areas of focus. I'm going to quickly move to this. These are the 9 ingredients, as they're calling them, or the 9 components of the action areas in the global strategy, coming from leadership, coming from your financing, health systems, individuals, community engagement, multi-sector action, humanitarian and fragile settings, research and innovation, and accountability. So these are all there, and once again you can get into the document and actually get more detailing under each ingredient and the tools and resources that we have. And one of the last slides that I have before I just move in quickly into what UNICEF is doing is the 2 pieces that I wanted to pull out. The strategy talks heavily of accountability, and we know that that's an important piece, often missing, often something that we need to be doing more about. And it talks about global accountability, but also country accountability, and then within the country accountability, and actually gives a method of how this can happen between global and country levels, and has set up an independent accountability panel who would actually create these accountability reports every year, annually, to know how we're doing until 2030, so that you can make corrections and do what you need to do. The other piece is very, very critical as well in the strategy is partnerships, and we know we can't achieve it without working together. And you'll often see this word H4 plus or H6, and you know, people think, what are these? But these are partnerships of different agencies. The H4 plus is UNICEF, WHO, UNFPA, UNAIDS, the World Bank, and UN Women. So we are coming together at a global level to do various things within the global strategy and playing a very important role in actually getting it implemented and actually holding people accountable. The civil society is an important player. And then I was like, I can't really write all the partnerships, so it's basically every single person. And I think all of us sitting here, we each have a role to play to make this strategy actually happen. So then I want to shift gear in my last, hopefully, maybe 5 to 10 minutes to just talk to you a little bit about what's UNICEF's strategy and what are we doing for the next 15 years across the world, but also in countries. As you know, we work across the world in 168 countries. We've got offices and we've been working, and actually it's just, as Haroon was speaking, I think it's been a privilege on behalf of UNICEF to say that we've been part of the child priorities all these years, and will continue to be so, because I think we all are standing for the same sort of mandate of what we believe in. So the UNICEF strategy draws in from the different global documents that we've got. We know we stand for the Convention on the Rights of the Child, the CRC, the CEDAW, which is the discrimination against women, but it's also linked with the global strategy that I just spoke about and the SDGs. And when we asked ourselves, this particular UNICEF health strategy was developed with multiple consultations across the world, with partners, with governments, with internal UNICEF staff. And there was some questions that came to our mind. What should a successful health strategy really look like? What should it really achieve? And you can see there's some boxes there, obviously very important boxes, but we're talking about it should be evidence-based. It should strengthen health systems. It must be based on a whole issue around equity, on integration and resilience. There's a lot of talk about building systems and building resilient health systems. And it must strengthen partnerships. It must do this. So I'll share with you what the strategy is, and you can look at it and maybe think whether we're meeting these things that we thought it should meet. And just some quick data to share the context of where it's coming from. We have realized that in the global world, we find that there are many children. 7% of children in the world actually live in very fragile situations, emergency situations, conflict situations, situations where you need an emergency response. You've got 23% living in low capacity, 59% in medium, and 11% in high capacity. And I'm going to share with you very quickly what this low, medium, high capacity really means. And we're seeing something quite interesting in these trends that we're analyzing. And I think, again, something to mull over for this group is that the income growth that's happening in countries is definitely moving children into wealthier environments, but not necessarily higher capacity contexts. And I think that's an important point to just hold the thought, that children may be living in a wealthy country or a wealthy situation, if you want to call it, or a context, but not necessarily a high capacity one. And that is a crux of the thinking here of what we need to do and not do. There's also quite a bit of emergencies. We know we read it all the time in the world and what's happening, and that's something to think about. And there's certain very interesting health trends. And again, I don't want to really read out everything, but what we want to just point your attention to is that almost 80% of the children's deaths are actually concentrated in under 5. So it's really the under 5 group of kids. And this is global. I'm talking of global data here. It is something that we need to pay attention to. And I mean, the last bullet is another important one, that the needs are varying by context and by region, and child mortality is basically concentrated in sub-Saharan Africa and South Asia. This is something for us as globally to look at and do something about. So this is what I was speaking about, and to just pause for maybe 30 seconds on this slide, I think it's an important one to think about, and also to think about it from the context of South Africa and see whether we could apply this for our districts, for our sub-districts, for the work that we do. There's a new country categorization that is coming up that is talking more on capacity rather than income. And we're talking of emergency settings, fragile settings, low capacity, medium capacity, and high capacity. And to really look at the emergency one, we know what we're saying there. There are life-threatening situations, something needs to be done ASAP. There are fragile contexts that are post-conflict or areas with crisis that something needs to be done there. But there's low capacity where you have insufficient resources, low functioning government and infrastructure, medium capacity where you have low resources, a medium functioning government and infrastructure, but you have equity problems, and high capacity where you've got a lot of resources, a highly functioning government and infrastructure, but you still have equity issues. And these are some things that are sort of the trend of thinking now to actually sort of reach out to children who are living in these situations versus just categorizing countries like middle income, high income, low income, and things like that. So this is a graph that shows the spread of countries in the world and where you can actually see the capacity being defined as a product of income and government effectiveness. Because we do know that children bear the brunt of a not so good, not so well functioning health system. They are the ones who bear it the max, and especially the under fives. And you can see that you have many middle income countries that are still low capacity due to low government effectiveness. And I just want to, at the bottom, maybe it's too small for you to read, but it's actually talking about what really defines government effectiveness. How would you say this government is effective, or low capacity, medium, or high capacity? And it's talking of the perceptions of the quality of public services, the quality of civil services, the degree of independence from political pressures, the quality of policy formulation and implementation. And I think that's an important one. You could have the best policies, but they're not implemented on the ground. And the credibility of the government's commitment to such policies. So there's been a whole analysis and a whole modeling exercise to understand the capacities, define them, and then group countries based on this. And what turns up is that 12% of children actually live in low-income countries, but 30% are living in fragile and low-capacity contexts. So it's extremely critical for us to kind of start thinking about the capacity issues and to try and define that and tailor your programs and your response. And you can see that if we can do that effectively, we're actually going to reach many more children versus just an income classification. These are the shifts that we expect. We expect countries to be moving into this, and that economic growth will take place. People will move income-wise, but it is also important to measure the government effectiveness and as we move across the ladder and get to the last point of where we want to get to. So this is, I'm not sure, do we have 5 minutes? Oh, 2 minutes, okay. So this is few slides. I just have 2 or 3 slides left. This is actually the one slide that shows you the strategy as a whole. And I know it's a busy slide, so just maybe bear with me for a minute as I run you through it. It's actually an important one, and then I hopefully I can close then. So this is our strategy where the vision is right here, up here. And it's a world where no child dies from a preventable cause, and all children reach their full potential in health and well-being. We've got 2 big goals, and one's about ending deaths, and the other one is about health and development. We've got 3 big approaches of inequities, system strengthening, and multi-sectoral policies and programs. And we've got 4 big actions here. We've got advocacy for every child, child's right to health, influencing government policies, that is something we do quite a bit. We're strengthening service delivery at the ground, and we are ensuring we empower communities. And we are trying to look at these 2 big program areas. One is on our maternal newborn child health, and the other one is on the older child and adolescent health. And there's a major focus on measurement, learning, and accountability. So that in a nutshell is what's UNICEF's strategy that's achievable through partnerships right up here, down here. And then a snapshot of how it will work. Again, it's a crowded slide, but hopefully you can look at it at some other, I think we can make these presentations available so you can have them and look at them. But it's a multi-sectoral program across the life cycle. It goes from pregnant women right up to adolescents aged 10 to 18. And you can see there's got several programs here on this side and this side. And we're talking of where we're going to do this. This is an absolute must to be done in emergency situations and fragile situations and low capacities, while this needs to be also done in medium and high capacity settings. 3 big thrusts and sort of levels of work that UNICEF would focus on for the next 15 years, and that's our community piece, our district piece, and our national piece. And I know Haroon spoke about the 3 feet work. It's some work that we've been leading with the government and the National Department of Health in some districts, and that actually talks about all of this. And we've got materials for the 3 feet work. We've got booklets and some videos, and we are hoping we can share that with you as you spend your 3 days here. Again, not going to go into the slide, maybe you can look at it, but this gives a snapshot of how we're going to work around our health system strengthening approach. We're already doing it with the 3 feet, but it actually tells you the whole process of how it works at the district level in ensuring that we're able to make the policy actually work, the implementation actually work. So I want to leave you with this thought of it's one world. There are many, many strategies. I think you'll be inundated. If you Google child health strategies, I think you're going to get a zillion strategies. So there are many, many strategies, and they kind of sort of come out and say the same thing. There are different contexts. We are in a context of South Africa, but we all say that South Africa is many worlds, and we all know that. We come from different districts, provinces, different settings and contexts, but we all want the same results. And I think that's the common factor here. We are all working towards ensuring that the children get the best they can get. And it's a world where no child dies from a preventable cause, and all children reach their full potential in health and well-being. I'd like to acknowledge, just for 2 minutes, acknowledge the people that helped me put this slide. It was a global presentation, and apologies from our global team who couldn't actually be here, but it's our head of health, that's Dr. Stephen Peterson, Guy and Abid, who helped with the presentation, as well as our regional advisor for health in Nairobi, Gabriel. Thank you very much.
Thank you, Sanjana. I think we've had a wonderful